What's going on, guys? I hope that everybody can hear me. Testing one, two, three. Testing one, two, three. Um, testing one, two, three. Testing one, two, three. Testing one, two, three. I was having some problems with my audio recently, and I still learning how this all works. So thank you guys for bearing with me. Um, great, great, great. Digital digital health diagnostics and mobile phlebotomy. Digital health diagnostics and mobile phlebotomy. This is a subject, guys. Let me jump right in again. Javon Harley here, um, where here you'll gain knowledge and skill to better your business as a mobile phlebotomist, as a healthcare provider in the various spaces that we are in, from innovation to uh, development to business creations. There's so many opportunities for our healthcare allied healthcare providers, especially mobile phlebotomists. That's my focus, is phlebotomists, and medical assistants are in that category. Some nurses are there in that category too. Um, but here, I was thinking about my approach and what I wanted to provide the community that's here. Thank you guys for joining. Um, and what I want to focus on is you gaining information and knowledge. I was recently having a conversation with my staff, my customer service staff, and I realized I like to provide, education, and I think that across the board, the education for phlebotomists is extremely important. For healthcare providers, it's extremely important. Getting to understand how to run your business efficiently is important. So that's what we're going to do. We're going to start by learning and get an understanding based on my experience, based on based on the environments that I am in, and the spaces that we again want to be in too. So so digital health diagnostics came up to me recently, and I just wanted to talk through what digital diagnostics is. So digital diagnostics in a nutshell is a software or application that is used to essentially facilitate, um, more innovative ways for healthcare. And I wanted to touch on how phlebotomists can be a part of that, kind of that journey and that innovation. And I want to discuss maybe some collaborative efforts between, different partners that are out there in the field that could benefit from mobile phlebotomists. And I wanted to, um, I'm just looking through my notes real quick, and I wanted to talk about, positioning yourselves for the next wave of healthcare. So you'll hear me say time and time again that healthcare is moving into the home. Um, it will continue to provide more access to patients, whether they have the resources to get out and about or not. And the convenience of a healthcare provider is crucial. And so just think about how you enter into a patient's home as a mobile phlebotomist, as a nurse, as a healthcare provider, and assessing what's in that environment. And what's in that environment is their day-to-day living environment and steps, right? And I guess what I immediately think about is like their kitchen or their even their environment of where they live. Those things can affect their health. Stressors, access to healthy foods, and digital health will come into play as a connector to the your primary care physician or the patient's primary care physician. And multiple phlebotomists will be a part of that connection. So I looked up a couple of different ways that, and I do this for you guys so that you don't have to, right? You can come here and gather that information, but here as a mobile phlebotomist, as a healthcare provider in the field, traveling nurse, anybody that does things in the home, there are your iPads, right, that are tracking documentation. That then goes back to the physician so that, or practitioner, so that they can make a decision. There are different types of home monitors, whether it be a Holter monitor or EKG machine, or pulse ox, or many other devices that they have and creating, that again will communicate or be transmitted or relayed back to again the practitioner to again make assessments and make decisions for that patient's health. The labor force, as some of you may know, is wavering, right? It can go up and down. We had a nursing shortage, then there was an increase. Now there's a shortage again. Just depends on what environment you are. Same thing for mobile phlebotomists. There's a wave of increase and decrease in different areas that require us to do more recruiting or do more training, education. And one of the areas that is going to be needed education wise is understanding how to use the various different monitoring devices that are out there. So let's just name a few monitoring devices. Your simple thing is your blood pressure machine. Um, Being a healthcare provider and relaying proper blood pressure readings for patients is crucial. So if you're a mobile phlebotomist and you don't have a basic, um, digital blood pressure machine, you should. Definitely old school is great. I like old school. Put the cuff on the arm and listen in for the beats. Yet there are some benefits of having that digital record. So recommend that. But again, another device would be a glucose monitor. Again, maybe patients have that, but maybe that's something that you guys can have as a glucose monitor, checking blood sugars to see where their levels are at. Um, there may be an activity tracker, these watches or the various different gadgets that are out there that are tracking our heart rates, our steps, our movement, are monitoring devices that can be used to aid in the development of a health plan or an improvement plan for patients. So this is where that digital diagnostics comes into play. Pulse oximeter that checks your pulse, the oxygen in your blood. It's a little clip that they put on your finger, or various tools like that. One more would be a scale. I brought to you guys some basic things, but a scale would be a weight scale would be ideal too. Not knowing what your weight is, you're making some modifications here and there, changing your diet, but maybe running away from what the scale is showing you. But maybe it will help you or help the patient, right? And so those are the things that are part of some other health monitoring. Those are common things. But again, I touch back on ECG or EKG machine. Those are devices that uh, will be used for monitoring. Again, I mentioned a Holter monitor. Holter monitors are, small wearable devices that record, the heart, over a 24 to 48 hour period. So Holter monitors are a part of that digital diagnostics. There are some implantable cardiac monitors they're placed underneath the skin. They are also are checking the heart and the activities that the heart is doing. So I can go over several different lists, but those are areas that if you're not trained in or you're not aware of, how can a corporation or a company reach out to you to provide that service in the field? Um, eh, Not all of our training, at least for mobile phlebotomists, is aligned to that. But sometimes you guys are exposed to it by places that you worked, or maybe events or health fair events that you've done. Really start to seek out how to get knowledge, and it doesn't require spending hundreds of dollars for a certificate. It's just having that knowledge base. So I would encourage you to do that. um, the other thing that I think about is, so if I have this information and this knowledge and this skill set, where do I apply it at? Who do I connect to? Who would benefit from that skill that mobile phlebotomist that I have? And there are several telemedicine groups out there that will need and that are needing your assistance in the field, and they either have a system that's connected to their telehealth monitoring system or their EMR system, or they can utilize the data that you capture or you collect in real time in the field. Um, some places like Zoom for Healthcare. Zoom for Healthcare is a video conferencing platform designed specifically for healthcare providers. So it's several different types of telemedicine groups out there. Open Loop is another one. DoxyMe is a simple, secure telemedicine platform that allows healthcare providers to connect to virtual appointments and patients. Another company to reach out to is Amwell, another telemedicine platform, and then Teladoc. You may have seen Teladoc if you have insurance. They have are probably one of the top telemedicine providers in our nation, and they are continuously expanding on their reach. So Teladoc will be another group to be able to utilize your resource and your skill sets in the field. And then one more I'll leave you with is MD Live, or yeah, MD Live, which is another telemedicine platform for board certified physicians, pediatricians, therapists that can will utilize mobile applications. So why is this important? Well, what can a mobile phlebotomist do for those groups? You can you can offer your mobile service to them, um, collect lab samples, have your blood pressure machine ready, pulse ox, pulse oximeter, different types of home monitoring devices, or they may supply you with those monitors, excuse me, to provide services out in the field. Digital health is now going to collect that data. That data will then be generated into um, information for the practitioner to make decisions for the patient's health, but also it will give us better snapshots of what the patient may need for the future. Um, Maybe in the example, Miss Sanchez is in an environment where she doesn't have access to um, a organic grocery store or organic supplies that can better, aid her in her taking control of her health. That may be passed down. That data may be given or sold to groups where they can make changes in those environments. So you may see from that data that newer Whole Foods or different types of grocery stores or developing gardens, community gardens would be a useful aspect of those different environments. Um, Again, changing routes to get to the hospital could be another option. Providing more urgent cares or smaller clinics where patients can have more access to healthcare providers. I see that we will have staged areas for telehealth. Um, as we migrate into the home, I don't think we're definitely not fully into the home yet, but we're going to get there. And I think one of the steps is to provide easier access to patients to have access to their healthcare provider. So if they don't have broadband internet, I know there's a big push for that. 6G is coming about, 5G is pushing out a lot of data information. It will be an opportunity for us to partner up with digital platforms who will essentially want to communicate or provide some type of link to patients, a service, and then back to the provider. So we can position ourselves to those groups as well. Um, Guys, thanks so much for joining in today. I just want to take this time to look at again digital health diagnostics and mobile phlebotomy. I would love to get some comments. I'm not sure if anybody who or any of my crew that's out there, maybe my moderators, if you can let me know if all the chat is on, that would be great. Just want to make sure that everybody can communicate. Again, guys, thank you so much for working with me. But again, today is about understanding and knowledge and knowing the different opportunities that are out there for us. We have a long reach for connecting to healthcare providers in the field. And okay, thank you. And one of the things, and I got to change that profile. Thank you guys for letting me know. Not able to make comments, but I will make those changes. But one of the things that are important for us is to. I think I can change it. Bam. All right. So try again. If everybody who's on, if you can try to chat, I just saved it. But one of the things that we need to pay attention to is all of the changes that are happening in healthcare. How does it affect you? What can you do to position yourself to be ready for this opportunity that is expanding? Innovation is happening all of the time. How can you prepare for that? Um, where where should you go and get the information or training to now provide that service? There are groups like Beyond Mobile Health that have connections. There's Carmichael Medical Training. There's tons of training groups out there. Arm Hug has great information. So, where are you going to gain this knowledge and access? Here, we're going to start looking at and collaborating with different partners who will provide this training. I dare not say for free, but training. Investing in yourself as a business owner, as a self-employed person in the field is important. So you should invest in yourself. Um, so ending this segment will I hope that you guys have gained some knowledge about digital health and how mobile phlebotomy and access to the various monitoring tools can help you in your business. Think about think about how you can benefit different agencies who will need your services in the different areas of where you work or where you promote or where you want to provide access. So I look forward to talking to you guys next week, and I am signing out for today. Great work for you guys. Thanks again for joining us.